Hi, I'm Mark Dunford from Sussex World, and I'm here today at the new Bupa Health Clinic in Endeavour House in the business quarter at Manor Royal in Crawley. I'm here to have a health assessment. So the health assessment gives an overall view of my health and well-being, and it offers tests for diabetes, cholesterol, mental health, and any musculoskeletal conditions that I might have. So I'm going to go in now. I've got some time with a health advisor and a GP, and let's see how we get on.
My name's Beth, I'm a health advisor with Bupa, and I will kind of be performing two different sections of your assessment today. What I'll start with is just kind of how the assessment will look. So your assessment is split into three different parts. The first part is an hour with myself, in which we'll do kind of a lot of the statistical testing. We will check in with a lot of different elements of your health. We will look at your blood pressure, we'll look at kind of things like your height and your weight. We will run an ECG just to kind of check in with your heart health. We'll also run things like your body composition just to check out your body fat percentage versus your lean weight. We'll run a few blood tests just to kind of check in with how kind of your bloods are doing, and then we shall go from there. We'll also chat about your lifestyle, we'll chat about your diet, your exercise, all of that kind of thing. We'll get a holistic view of your health at the minute, and we will go through the results and chat through kind of different things that we can kind of pick out and see how we can look to improve your lifestyle and your health a little bit, and just check in with where you're doing well and where we could kind of look at improving it a little bit. Then following that, you will get some time with the doctor to discuss any specific medical concerns that you may have. It's a really good opportunity to kind of check in and sit with the GP without, a lot of the time people go to GPs with XYZ problems. This is a good opportunity for you to kind of sit with the GP, have a conversation, and then we can check in on various things. If the GP wants to send off any additional blood tests, we can do that. And it's just a good opportunity to kind of talk to a doctor, talk to a medical professional about your health at the minute. And then the third section is the exercise testing section. That is split into two parts. So we will do your grip strength test there. So that will give us an indication of kind of your muscle mass, how kind of strong you are at the minute. And then we will also get you on the bike and do a predictive VO2 max test, which essentially tells us how well your body uses oxygen during exercise, and it will tell us what your cardiovascular fitness is like. So it will kind of categorise you on that and tell us kind of how fit you are with regard to that. Have you got any questions about anything that we're going to go through?
No, but I'm just terrified about the exercise side of things. But
we'll chat through it. So I'm going to do it from both of your arms, essentially just to see if there's any significant difference between your two arms. We expect there to be a difference,
right,
but anything that's too large, we just look into a little bit more and check out, kind of bear in mind. So you've never had any blood pressure issues before?
No.
Okay, so I'm going to pop these cuffs on you. They're going to be snug, but they shouldn't be too tight just to start with. I'll pop it on this arm just to start with. And then we should go from there. I'm just going to roll up your sleeve a little bit there so I can get a nice bit on there. At the same time as running your blood pressure, or kind of alongside it, I'm also going to run a little machine called cardia. What that does is it just checks for any irregular heart rhythms.
Okay.
So the cardio will run for a minute first, and it will just check whilst the blood pressure does a 60-second countdown for you to imagine you're on a beach and
okay.
So the cardio will run during that 60 seconds, and it will just simply check if there are any irregular heart rhythms going on there. Okay. So the cardia is this little contraption. Mm-hmm. So all you have to do for it is rest two fingers on each of the metal plates like so.
Like that, yeah.
It will run for a minute. The cardio is slightly sensitive to sound, so you might just want to relax there for a minute. I'll pop in some results that we've got so far. Yeah. And then the blood pressure will start straight after the cardio. That's nice and normal. I'm not concerned about that at all, which is
lovely.
Good.
That's always good to hear.
Perfect. So your blood pressure is nice and normal. I'm not concerned. There's no significant difference between your two arms. It all falls within the normal range. The heart rhythm screen as well showed as nice and normal, so there's no evidence of kind of any irregular heart rhythms going on there. So I'm happy so far. What we're going to do now is we're just going to run that ECG just to kind of check in a little bit kind of in more depth to check with how your kind of heart's electrical activity is going, and then the doctor will be able to review that and just check that they're happy with everything going on there. I'm
midway through now with the health advisor Beth. We've just done a blood test. Beth's just gone out to find out what the results are of the blood test. So let's see what we've got to say.
Your bloods are generally all good. I'm happy with all of them. Yeah, no, it's definitely kind of reassuring. The only thing that if I would kind of suggest looking at tweaking something is just looking at seeing if we can switch out some of those saturated fats just to reduce them a little bit, just so that kind of they continue your good health kind of as you kind of get older and kind of looking into the future. Do you have any questions about any of those results?
I don't think so. And is it purely diet that this comes down to?
It will. Things like cholesterol will be influenced by exercise. So
okay.
One way of also kind of counteracting your cholesterol results a little bit is exercise will play a part in it. It to a degree will depend on how much is being stored in your blood. So things like exercise will kind of offset that a little bit. Diet is a massive part of it, but exercise will play it. So the next thing we're going to run through is your MSK. So essentially what this is a series of different movements, and it's just checking out the range of motion you have in each of your joints. It's kind of checking out how your muscle groups are doing, if there's any limited range of motion, if there's any discomfort kind of in each of any of the movements. What we can do is, if there's limited range of motion or kind of something that's a little bit mild, what we can do is we can pop some exercises in the report, different ways you can kind of increase that a little bit from home. And then if there's anything that's a little bit more severe, we could refer you to physio. We can kind of chat through it as we go, but we'll have a little look and we'll see what's going on. So we're going to start at the top of your body and work our way down. So the first kind of set of movements is all around your neck and your head. Then we're going to move down to your shoulders and work our way down your body from there. So the first thing you're going to do is you're just going to bring your chin down to your chest for me. Try to avoid bringing your shoulder up to chin as much as possible. How does that feel?
That feels a bit tight, just generally tight. All around kind of thing.
Okay. Okay, perfect. Are you feeling any tension there?
Not a huge amount of tension, but certainly that's as far as I can go.
Yeah, it's a little bit of a reduced range of motion, so we'll kind of check it out. Try the same movement with your right arm, so you can bring your left arm down. How does that feel?
That feels fine.
That looks slightly better, just in kind of where it's getting. It's still a little bit limited, but I'm going to try and touch your toes for me. Let me know where you're feeling it, if it's in your lower back, if you're feeling it in your hamstrings, in your calves, just kind of let me know.
It might be all of the above.
That's absolutely fine. How does that feel?
Actually, that's further than I thought I was going to get.
Yeah.
It's mainly the hamstrings and a little bit the lower back, but it is mainly the hamstrings.
Okay. Okay, next is nice and easy. Hands on your hips. You're then just going to test out your hip rotation for me. How does that feel? Try holding it at either side as well. That will feel okay?
A little bit of tension across the lower back.
Okay. You're going to stand on one leg. This is going to be funny for the video.
Yeah.
You're going to try and keep the leg in the air at about a right angle.
Yeah.
Once you've got your balance, the challenge is then you've got to try and close your eyes for about 5 seconds. Obviously, if you feel yourself falling, open your eyes, because I don't have much faith in my catching ability. Yeah. And if you feel yourself falling, I would aim towards the bed. It looks more comfortable than this.
Yeah.
So you want to try for about 5 seconds. I'll tell you when to relax, but obviously open your eyes if you feel yourself.
Yeah.
And relax.
That was... Oh, yeah.
And relax. That's good. And then the last one is just an overhead squat. So you're going to put your arms straight up in the air, feet about shoulder width apart, heels on the floor, and take a nice deep squat. And then bring yourself back over. Watch yourself on the back of that trolley as well. How did that feel?
Yeah, that felt alright. Knees a little bit tight, but no, it wasn't painful or anything. So.
There are 2 different parts of exercise testing. The first is a grip strength test, so we will essentially just be determining what your muscle mass is like. It's a predictive version of muscle mass, so it's not getting you to kind of lift anything where we could kind of start causing injuries and things. What you're going to do, first thing you're going to do is you're going to make sure you've got a nice comfortable grip, so we can move this little bar away or further closer together should you need it. You're then going to hold it down by your side. You're going to squeeze as hard as you can. You're going to get a number that's much more than 29 because I am weak. We're going to take 3 times from each side. I'm going to take your best score from each side because sometimes the first time you're just getting used to the technique a little bit. So 3, 2, 1, go, 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 and relax. Let me just see that number there, 38.5. 3, 2, 1, go, 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 and relax. What number have we got there?
Oh, 37.
37.7.
I think so.
3, 2, 1, go, 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 and relax. 39.4, getting stronger.
Getting stronger.
Back 3, 2, 1, go, 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 and relax. What number we got there?
Oh, exactly the same.
37, exactly the same.
Yeah.
Then following on from that, we will go through those results. We will also then do your predictive VO2 max test. That is kind of the bigger test of the two. That is on the bike. It's a test which tells us roughly what your cardiovascular fitness is like. So it will predict how much oxygen your body can utilise for exercise.
Okay.
So it's a really kind of interesting way of kind of looking at your fitness levels. It is a predictive test, so as I said, we're not going to be kind of working you to 100% your capacity. We're going to get you to about 70%, so you'll get to about 7 out of 10. Throughout the test, I'll show you this scale.
Okay.
So 1 is completely relaxed, probably as you are now. 10 is maximum effort. We're only getting you to a 7, so you're going to be getting to breathing heavily, unable to say more than 1 to 2 words. And we'll kind of see how we're doing throughout them. Yeah. Okay, so this is the screen that you will be looking at. There's lots of different elements to it, but the bit I want you to mainly focus on is this section here.
Yeah.
What this does is, as you start pedaling, eventually when we click play, a big bar will appear. It will be orange when you're further away from the bar, green when you're closer to the bar. You want to keep it as close to that line as possible.
Okay.
There you go. So if you start pedaling now, you'll see a bar start to appear. You want to keep it as close to that 70 as possible. So you want to just kind of, the first minute is getting used to that speed and getting that initial speed just to get going. Right, as a practice, give me a number on a scale of 1 to 10. 1, perfect. So in about 5 seconds it's going to increase a little bit, so that bar's going to jump up and you're going to be pedaling that little bit faster, so you're on that 80 now. Right, give me another number.
Probably 3.
3?
Yeah.
Feeling good?
Yeah.
Good. Good, that's what we like.
This is the catalyst I need to get me on my bike again.
Yeah, no, definitely. I mean, it's a lot nicer when you've got a nice view.
Yes.
But cycling's good. It's a nice low impact sport as well.
Yeah.
So it's really good. Give me a number.
I think, edging towards 5. I'm breathing a little bit harder. Edging towards it.
I'll put 4 for now. Your heart rate's still doing good, which is nice. Right, give me a number.
Yeah, maybe edging towards 6, but...
I'll put 5/6.
Yeah. I'm certainly not sweating profusely yet or anything.
Good. Pushing it up again. Right, how you feeling?
Probably 6 or so.
Probably 6. Got another minute in you?
I've got another minute in me.
Yeah, that's what we like to hear.
I'm not fully heavily breathing yet.
Doing very well. Got 30 more seconds. Right, keep it going for the last 10 seconds. What I'm going to do at the end of this 10 seconds is I'm going to put the resistance down a little bit. I'm going to give you a chance to have a bit of a cool down, so take as long as you need to stretch yourself off. Following on from that fitness test, there's plenty of numbers and results to go through. So in general, we kind of look at your predicted VO2 max, as I kind of mentioned earlier. We measure it in millilitres of oxygen per kilogram of body weight per minute, and that's kind of how much is available to you. Make sure I've got my correct graph out here. If we look at your age range here, you are 44, am I correct? Yes. And then look at this. Your predicted VO2 max came in at about 21, so that's in the needs improvement category.
Okay, yeah.
So it essentially looks like we could work on some things to improve that a little bit. Your predicted maximum heart rate here came in at about 165. Now with the max heart rate, this is kind of what it's predicting from the system. I think to a degree with your test, your legs gave out a little bit sooner than maybe your lungs necessarily did.
Yeah.
So that may affect this a little bit because your heart rate wasn't pushed to kind of a degree. So your predicted max heart rate comes out about 165. Generally in school, kids are taught that your max heart rate is something like 220 minus your age. That's a very basic, generalising way of putting it. This is a little bit more personalised to you. So, anthropometry wise, this is everything physique based. Now, obviously, we've spoken we've spoken about a couple of different things. These are all kind of showing the same trend, which I think we're expecting to a degree. So your BMI is on the high side. I don't know if you know much about BMI as a reading in itself.
Not really, I know, roughly it means.
BMI, so it looks at your height versus your weight, essentially.
Yes,
by itself, it's not the most amazing thing in the world just because it looks at you as a lump. It doesn't consider your muscle mass versus your fat mass.
Okay.
So someone could be
like a rugby player.
You could be a rugby player. You could be really muscular, and it would consider you to be obese just because you're still dense, like you're still heavy in comparison to your height. So we use it because actually it's really good in combination with the other things. So it's good at looking at it in terms of with your waist to height ratio, with your body fat percentage. But it's one thing that if you're looking at it by yourself, like just by itself, it's one thing to bear in mind.
Okay.
It's really good at categorizing children because children don't tend to be particularly muscly or anything like that. But when you get to adulthood, like it varies a little bit more.
Yeah.
Waist to height ratio is saying a similar thing. So it's
off the scale. Dr. Wallbank mentioned that.
Yes.
And I've never seen anything literally off the scale.
It's up there somewhere. I mean, scale stops at 70. You came in at 74, so it's just saying we want to reduce that a little bit if possible. What I would recommend is a combination of diet and exercise, making those kind of small achievable changes. If you suddenly turn around and try to turn your life upside down, eat nothing but salads and run 10 kilometers a day, it's just not going to work. You're not going to sustain that. Making those small kind of achievable changes, so making some adjustments to your diet. We spoke about kind of cholesterol and things like that. Making it might be worth looking at something like portion size, things like that, with regard to your diet. But then in conjunction with putting some exercise in, some kind of exercise that gets your heart pumping a little bit. So I always recommend to people finding those the exercise that they enjoy, trying a few different things, because if you enjoy it, you're going to sustain it a lot more. This is currently saying that you are at 2.9% chance of having a heart attack or stroke in the next 10 years. Score of a healthy person of the same age, sex and ethnicity is used 2.11%, so that puts you at slightly increased risk. That will partially be down to your body weight at the minute, and the fact that ratio, so one of the blood ratios was at the higher end of normal, is kind of teetering a little bit. So if we address any of those, that would reduce that a little bit. So it's kind of just telling you kind of roughly where you're at. It's predicting your heart age at about 48. So again, that's one of those things that just kind of tells us kind of where we're roughly at the minute.
I was expecting worse, to be honest. So that's good.
We'll do the same thing with diabetes, which is 7.5%. That is slightly higher, and that is most likely due to body weight at the minute, because it increases your risk. But if we reduce that, it would reduce your risk, and then we can go from there. Your cardiac came in as normal, so there's no evidence of any irregular heart rhythms today, which is good. Your blood pressure came in as normal. There's a small difference between your two arms, but nothing excessive, which is good. ECG, the doctor will have looked at. The fact that she was happy to clear you for a bike, I'm happy with. Okay, so what I'm going to do here is I will come back after kind of we've let you go, and I will fill in the rest of the report. I will put in any additional resources that I think of that may benefit you, any different kind of tips and tricks that I've got, and I will fill in the rest of your report, and make sure that we've got kind of, I can give you as much resource-wise as possible.
So I'm back home after my health assessment at the new Bupa Clinic in Crawley, which is based at a business quarter in Manor Royal. And I must say, I really enjoyed the experience. Beth, my health advisor, was fantastic, made me feel at ease. Dr. Joanna Wallbank, she was really good, gave me really good advice. And since I've got home, I've got my health report emailed to me. So these are my unique results. You get them on email. I printed them out just for my own attention because there's some really good exercises and really good advice there. So I wanted to print out so I know I can take them with me and I can do them wherever I go. Yeah, there was no surprises in the summary. It's I'm overweight. I know that. I don't exercise enough. I know that. My diet isn't the best. I knew that. So in regards to that, I heard exactly what I thought I was going to hear. But there was nothing untoward, and it was really good peace of mind, and it's really good just for preventative advice, really. Yeah, so my BMI is 39.9, and I have an unplottable waist to height ratio, which is interesting to hear. So my focus area is my physical activity, and my goal is to increase exercise and evaluate and making small changes to my diet, which I've already started. I've already started eating more oily fish on the advice of Dr. Wallbank. So yeah, hopefully this will be the motivation I need to have a look at my lifestyle. I don't need to make huge changes, but I need to make some changes, and that's what the health assessment is there for, to help people and guide them to a better health and a better lifestyle.